This is Dr. Eric Goldstein. I'm one of the gastroenterologists at NIGA. It's my pleasure tonight to introduce the topic and our speakers and try to help field some questions. Thank you all for joining our talk tonight on about navigating dietary supplements for GI issues. Are they potent, placebo, or poison? Um, this is a topic that's both very interesting and frustrating at the same time. When we talk about supplements and complementary therapies, as good scientists and clinicians, we have to keep an open mind. And the notion about learning about options to treat our patients is always exciting. On the other hand, the providers at NIGA believe strongly that supplements and other complementary therapies can and should be subjected to the same scientific and professional principles as traditional Western medical treatments, both for the effectiveness and most importantly for safety. For example, many of you may have heard about St. John's wort, which was, widely touted as the next great natural antidepressant, as good as prescription medications. And it was really in vogue for quite some time, and medical data started to show its efficacy. And then a lot of safety questions came out, and it turned out that because of pharmacologic interactions between the active chemicals in St. John's wort and made it virtually impossible to take any prescription medications without interactions and side effects. So tonight, we would like to introduce you to not just some supplements that may be helpful or particularly harmful that we encounter in the digestive healthcare sphere, but also introduce you to a bit about how we analyze the safety and efficacy of supplements, including vitamins, herbals, peptides, and probiotics. I'd like to introduce our speakers, but before I do that, just a couple of housekeeping notes. First, this webinar is being recorded and will be available in the future on our website. So don't worry if your phone rings or the dog starts barking over something we're saying. It's not that important. It'll still be there in the future. Second, there will be time at the end of the talk for a few questions, which I will either answer or propose to our speakers, or some I will answer as we go along if possible. Please type them into the question and answer feature of Zoom. That's the only window that I'll have open for review. If you put it into the chat button, I won't see it, so don't use that. So tonight we'll be hearing from two of my favorite and most fabulous colleagues. Tamara Freuman is a registered dietitian who spent the entirety of her career in clinical GI practice settings, specializing in dietary management of digestive symptoms and diseases. She got her master's in nutrition from NYU after doing undergrad at Duke University. And Tamara is the author of two incredible books on the diagnosis and management of digestive disorder, The Bloated Belly Whisperer from 2018 and Regular from 2023. She's also on the medical review board of U.S. News and World Report. And we're proud to say that we're giving a talk together in a couple of weeks at DDW on how we wound up spending our last decade and a half together in integrating dietetics practice into GI practice. Dr. Yevgenia Pashinsky is a fabulous partner and office mate. She is not only a well-trained gastroenterologist who did her training after Mount Sinai and then got stuck spending the rest of her life here affiliated with Mount Sinai through being a NIGA gastroenterologist. She's also an assistant professor of medicine at Mount Sinai Hospital and likes to rub in the fact that even though I'm older, I'm not ranked that high. And I think that this is going to be an exciting talk, and I hope that you'll all be able to learn a lot. With that, I will turn the floor over.
Thank you, Dr. Goldstein. Thanks, everyone, for being here tonight. It's great to have so many people here. We have a lot to cover, so I'm going to jump right in and start us off with just a little bit of background about dietary supplements and how they are regulated. And then Dr. Pashinsky will take us through some of the specifics. So just to ground us all in what we're talking about here, what are supplements? Supplements are substances that people take to somehow enhance their diet, to enhance their diet, to enhance their health. The idea is that you take these and they're supposed to be good for you. There's a lot of categories of dietary supplements: vitamins and minerals, proteins, or the building blocks of proteins, which are called amino acids, different types of botanical compounds or herbs or extracts from herbs, fiber, different types of isolated fiber from plants or lab-made fiber, and also live microbes like probiotics. A lot of people use supplements. So according to a survey conducted by the supplement industry, about 3/4 of people do. But I would say probably about half of Americans, or a little over half, are actually pretty regular users of dietary supplements. So a lot of us are using these. And so understandably, there's a lot of interest in how to kind of tell what's good and what we should be careful about. I think the really important place to start is understanding how supplements are regulated and frankly not regulated. And so the piece of legislation that's most relevant is called DSHEA. It's the Dietary Supplement Health and Education Act. It's from 1994, which is actually not that old, like 30 something years, 30 years, actually exactly 30 years. Um, and this was a piece of legislation that is pretty widely regarded as an industry-driven bill, or like a gift to the supplement industry, that was introduced and really shepherded through into passage by Senator Orrin Hatch, who was from Utah. And he had a lot of ties to the supplement industry. He got a lot of money from Herbalife and other types of supplement companies. And so this act doesn't really seek to regulate dietary supplements so much as to unregulate or deregulate them. Okay. And so, unlike drugs or over-the-counter medications, dietary supplements safety, dosage, and labeling claims are not regulated by the Food and Drug Administration. They are to be self-regulated by supplement marketers. And there's really no enforcement mechanism. Nobody's checking. The FDA is actually explicitly not authorized to monitor or approve any supplements before they are put on the shelves. And the only role really for the FDA in the supplement industry is to investigate complaints if somebody has a bad experience with a supplement. So if somebody takes a supplement and they get sick, or they feel that maybe, it's not potent or something is wrong with it, then they can, launch a complaint to the FDA. And if enough complaints are filed, the FDA doesn't investigate every single individual complaint, but if enough complaints start coming in about a category of supplements or a specific brand or product, then they will launch an investigation. And the only power they really have as a result of an investigation is to take a supplement off the market if people are having adverse events associated with it because of adulteration, which means that somebody put either a drug in there that's not supposed to be there, or an ingredient that was undeclared. We'll talk about what some of those might be, or something synthetic, something that's not supposed to be in it that wasn't claimed, and then they have an adverse effect from that. Or if it's contaminated, maybe with like a lot of lead or heavy metals, or if it's misidentified. And so if the product says that it's this herb, and then people are like, I'm not getting that benefit, and the FDA looks into it and they're like, there's a different herb in it, it doesn't even have that thing in it. So if it's misidentified, mislabeled, if they're making false claims, if they say that this will grow your hair and it's not growing your hair, things like that. And so you can imagine that this doesn't happen very often, because enough people have to really associate an adverse event with something, launch a complaint, and then the FDA has to investigate. So it's a pretty long and cumbersome process, and it really doesn't happen all that often. And so this is all to say that manufacturers can pretty much market an untested product with unsupported claims tomorrow. If you wanted to put a bunch of flour in a pill and put it in a box and say, this is a probiotic and it is gluten-free, you could do that. And it would probably be on the market for months, if not years, until enough people who have celiac disease got sick from eating your flour pills and launched a complaint. And then it was discovered that it is just a flour pill. So this can happen. What else do we need to know about safety and regulation on supplements? Anything that's a vitamin or a mineral does have an established higher safety level associated with that vitamin and mineral. And those are safe dosages that are set by basically like a branch of the US government, the Food and Nutrition Board of the National Academies of Sciences, et cetera, et cetera. Those are all available online. And so, for example, when you see you know, like the recommended daily intake, those are also set by the Food and Nutrition Board, but every vitamin mineral has a maximum safe level. And so one thing that I do a lot as a dietitian is if I have somebody who's taking 36 different pills, supplements, which happens pretty often, and I see that a lot of their supplements have the same vitamin or mineral, like zinc, for example, I start to go through and see how much are you taking, and I count up all the milligrams of zinc and I check it against the tolerable upper limit, and I make sure that the amount that you're taking is not dangerous. And that can happen a lot when people are taking a lot of different pills. And so, you know, being aware that these tolerable upper limits exist, and that if you take a lot of supplements that have redundant ingredients in them, it's not a bad idea to check and make sure that you're not exceeding any safe levels. But there are no government safety guidelines for other categories of dietary supplements other than vitamins and minerals. So it's not really clear like how much, you know, melatonin or herbals might be safe, because that's not really something that the government issues guidelines are. And that's where things can get a little bit dicey. So understanding what we just explained about how supplements are really not regulated in this country, especially before they're put on the market, you can understand that there's no guarantee and no confidence that you should have that a dietary supplement contains the precise dose that's listed, the precise ingredient that's listed, or that they don't contain what they say they don't contain. Things that are mislabeled, whether they have too much of what they claim or not enough of what they claim, having undeclared ingredients is really, really common. There's some data on the bottom of the slide, which we'll walk through. The FDA has guidelines for what a good manufacturing practice is, but they're not enforcing anything. They're not going and making sure that all these companies are doing any kind of good manufacturing practices. And when you actually start to look through the research, that different researchers or, you know, government agencies, or sometimes like the New York State Attorney General will start to audit a category just randomly. When people start to look into different categories of supplements, you see rampant mislabeling across a lot of different categories. Some of the more recent buzz is around melatonin, which is a hormone that helps people regulate their circadian clocks and fall asleep. And it's like very popular, and a lot of people are giving it to their kids. Almost all melatonin gummies that have been analyzed in a study from last year were mislabeled. Only 3 out of 25 products had a dose within 10% of what was claimed. And some of them had less than claimed, but many of them had a lot more than claimed. And if you're giving that to your kid, like that would be concerning. Um, you know, when we looked at herbals, a group of researchers looked at a bunch of herbals, over 200 different herbal type of supplements. Half of them were mislabeled. And 20% of them, a fifth of them, didn't had ingredients that weren't even declared on the label. That's a problem if you have a food allergy, or like me, if you have celiac disease and, you know, and there's flour in the product or wheat starch in the product that's not labeled, that's really a problem. A Columbia University study found that over half of top selling probiotics that were labeled gluten-free actually contained undeclared gluten. So you can see like there's a lot, this is a really problematic category to shop, and, you know, buyer beware. This is just a little snippet from a New York Times article from 2015 that was summarizing that the Columbia study about the probiotics. And these, by the way, were top selling probiotics, right? So these are not like tiny little niche brands that were fly by night companies. Like these were some of the top selling products in the country, which at the, you know, is concerning. One thing that the dietitians in our practice have access to is a subscription-based service. Anybody can subscribe. I don't know how much it is now. It's probably 20 something bucks a year. Anyone is welcome to subscribe. It's a company called consumerlab.com. And if you're a heavy supplement user, it may be a good investment for you. What this subscription-based service does is they have reports. They do audits as an independent lab, and they will just do a report on vitamin D or on, you know, different types of herbals. And they will just take a whole bunch of products off the shelf and test them independently and say whether they actually have what they say they have in them, the doses. They will, you know, look for contaminants like lead, cadmium, heavy metals to see if they have a high or unsafe level of those. And so this is an example of a printout or a screenshot of a product that was audited, I guess, when they were looking at calcium and vitamin D. And this is a product that found that they had way more vitamin D than was listed in the product. If that's a concern for someone, then they wouldn't want to take it. If someone's like, hey, that's a great way to get a higher dose for cheaper, go for it. But it's just super helpful to kind of have this type of validation because we don't have the ability to look into a product and see how much it has. Now, here's the opposite example that Consumer Lab found when they were looking at magnesium supplements. This was an audit where they found a particular brand had much less than was claimed on the label. And so if this is a brand that you were using, you might want to, switch to a different brand. And so people who use supplements regularly or who use a lot of different supplements, it might not be a bad idea to get a subscription to the service so you can vet the different brands that you use and see if they're up to snuff. I'm going to turn it over now to Dr. Pashinsky to talk a little bit more about safety.
So hello, everybody. Good evening, and thank you for joining us. So to continue a little bit more about, getting more than what you bargained for. Sometimes, oh, it's a little more vitamin D, it's a little vitamin D, but sometimes it could be really problematic ingredients that are in the supplements that you're getting. So a prime example of this would be aloe. So for example, aloe and aloe latex and whole leaf aloe are banned by the FDA. They were banned in 2022 because of significant concerns of carcinogenicity. But despite that, it remains, ironically, by the way, colon cancer was the cancer that was found in animals associated with this, but it remains quite often widely sold as a dietary supplement. And we have lots of patients that come in taking aloe all the time. It's quite effective because it is a harsh laxative, but clearly has safety concerns. And this is where the FDA is not reaching over to control this part of the industry. Also, in addition to the carcinogenicity concerns, aloe is very much known to cause significant kidney injury and in a dose-dependent manner. And as Tamara had mentioned, we are not really sure what dose anyone happens to be getting when they're getting a supplement. The other concerning ingredient would be kratom or kratom. I'm probably not going to say that right ever, but it is very natural. It is plant-based. It is an opiate-like substance that also has some stimulant effects in addition to opiate effects. It is very much not approved as a drug in the US, known to cause liver toxicity and seizures, but is very widely available. And actually, kind of walking by places, you literally see it advertised. There's actually currently debate, I think, in the FDA, et cetera, about actually banning it, but currently has not yet been banned. And then, the big thing is the drug adulteration that Tamara had alluded to. So, many dietary supplements have actual prescription drugs in them if you analyze them. So a big study in 2018, kind of looked at 800 various supplements, sold over almost a decade worth of time and found how many different things were actually in them that were not listed. And in many cases contain actually more than one. These are going to be the most risky, less risky for a lot of the GI things that people use, but very much part of weight loss, bodybuilding, and sexual function products. And some of the things that we find in these are actual Viagra, which obviously would work as a sexual function product, but probably not the natural one that somebody was looking for. The various types of amphetamine compounds that are stimulants, synthetic steroids, aromatase inhibitors, which are drugs that block estrogen production, which obviously could cause some pretty significant effects, and diuretics, which are drugs that make people urinate and could cause electrolyte dysfunction and kidney damage at the same time. So, in addition to that, there's been plenty of reports of pesticides, heavy metals, and antimicrobials finding their way in as well. Now, interestingly, a well-known herbal supplement is actually a prescription drug. So red yeast rice is actually exactly bioidentical to a statin, lovastatin to be exact. But because the doses are unregulated, you're taking a statin when you take red yeast rice, but you don't know how many milligrams of that statin you're getting. And I think everybody's aware that statins are known to cause liver damage in their own right and some liver injury. So that are kind of the intro to some of the riskiness that we're faced with. Next slide, T. So to really understand, the big point here and the concerns that we have is that any medication and a dietary supplement, which, whether it's herbal, whether it's over the counter, whether it's prescription, everything that goes into your body will have to get metabolized by the liver and the kidneys. Typically, drugs and herbals and everything else kind of end up having three types of metabolites. There's the active metabolite, there's the inactive metabolites, and then there's the toxic metabolites. So the active ones are the ones that really are kind of exuding the effect that you're looking for, the effect that you're looking to get from a particular medication or herbal. The inactive ones are just kind of, there, they don't really do anything either way. And then the toxic ones are basically active metabolites, but they're just doing something that we don't really want them to do. very important point is that drug metabolism does decrease with age. So, this is why in prescription doses, we often modify the dosing for older patients, which is obviously not something that's done by the herbal and supplement industry. All medications and supplements can interact with others, and also, very importantly, block certain liver enzymes that are responsible for the metabolism of both endogenous and exogenous substances, so those produced by the body that need to be detoxed versus those that are introduced into the body to be detoxed. Also, an important part that we'll touch base on in a little bit is that the liver is also responsible for storage of various vitamins and minerals. So interference with liver function by this can lead to downstream effects there as well. So next slide. So, the first rule of medicine, I think, for all of us is very much do no harm. And so to discuss some, specific things that are potential with supplement use. So as Tamara mentioned, a staggering number of the US population is using supplements. And it's rather common for patients to actually be taking dozens of these at once. And very importantly, patients often don't disclose this to their doctors. And even more problematically, many doctors don't ask or inquire about this. So it's extremely common for a patient to walk into one of our offices and, you ask them, well, what medications do you take? And the answer is typically none. I don't take any medications. And, it's a blank sheet on that. And then we really sort of pry about vitamins and supplements, and a list of, 30 items pops up. And that's not something to be taken trivially. So first and foremost, we worry about that liver that we just discussed. And supplement use is actually responsible for, 23,000 ER visits a year, and at least 2,000 hospitalizations annually, including, fulminant liver failure requiring emergency transplants that unfortunately, I've been privy to personally more than once while training on the transplant service. It's actually 1 in 5 cases of acute liver injury can be tied to a dietary supplement, which is quite a large number. So just because it's over the counter, it's natural, it's organic, it's gluten-free, does not mean that it cannot cause this. Once again, the riskiest categories remain, the ones in the bodybuilding and weight loss. Out of the herbals, really, really, really strong data for green tea extracts, the potent ones, that same crowder, black cohosh, ginseng. I mean, the list of herbals that are tied to liver injuries vast, and any one of you can access it on the NIH website. There's a lot of this with any traditional botanical mixture, so what we get from the Chinese herb industry. And quite frankly, simple vitamins and minerals can cause issues. So vitamins can become toxic. We'll talk about that in a little bit, but as far as liver injury goes, the primary ones would be from vitamin A and niacin, which can cause significant hepatotoxicity if they're taken in very large doses for a long period of time. And obviously, the more ingredients in any of the drugs you're taking and herbals you're taking, the more likely there is to be problems. So now, we talked about, the big, bad, ugly stuff, but too much of anything is not good. So even the simple things like vitamins can cause quite a bit of issues. So vitamin B6, we're actually all seeing a good amount of this when we're running nutrition panels of B6 being quite high. Chronic toxicity could cause peripheral neuropathy, which can become permanent and very much not a fun thing. Taking too much vitamin C can lead to kidney stones, in addition to causing diarrhea. So we'll talk about its safer use as a laxative. Taking too much zinc can lead to sort of a copper deficiency anemia because of issues with absorption. And for those patients who actually have celiac, which is, 1 to 2 per 100 people here, gluten exposure is a big problem. And gluten exposure in celiac patients is something that can actually ultimately, in addition to malabsorption and inflammation, can lead to malignancy of the small bowel. We'll have a whole section on probiotics, but we suspect that it could certainly lead to SIBO in those who are predisposed to developing it or have risk factors. There are multiple supplements that are blood thinning. So this is very, easy over the counter stuff. Everybody's taking fish oil. This happens actually to some degree with turmeric, vitamin E, ginseng. So especially combining these with any actual blood thinners that people may be using for heart disease and aspirin could lead to significant issues, both, surgically, procedurally, and spontaneously. Supplements like berberine cause significant drops in sugar and could really cause a number when they're combined with diabetic drugs. And, the big thing, what we talked about the liver, the interference with prescription medications by blockage of liver enzymes could lead to the levels of other meds going either up or down. So you could get toxicity from a particular medication that you're on that would otherwise not be toxic, or it could decrease the efficacy of drugs, for example, like seizure medications, leading to breakthrough. Last but not least, and kind of gross, it can lead to what's called pharmacobezors, which is literally a kind of a collection of kind of hard-looking goop in your stomach that is sort of composed of all of the capsules that these meds are made out of and shelled in, and sort of actually in time cause an actual obstruction of your stomach and then the exit to the stomach, which is really not a fun thing to have. Now, we don't want you to just be terrified and scared and say, oh, these guys just hate all supplements and they think all of it is nonsense. They just want to give us tons of medications. That's not the case. We definitely use and believe in plenty of evidence-based supplements that are out there that really do work for many GI problems. So, I'm sure, lots of our patients on this are familiar with a lot of the things that we use a lot of, but for GI problems like constipation and IBS with constipation, magnesium, is quite effective and very safe unless somebody has significant kidney problems. Senna, supplements that are aimed at fiber, which Tamara will discuss in a little bit. Vitamin C, when dosed, appropriately and not excessively in patients with no kidney stones and no risk factors for kidney stones, can actually be effective. The converse side, those with irritable bowel on the opposite end with the diarrhea, there's many versions of enteric-coated peppermint. That same fiber could actually work for both constipation and diarrhea. And there's a particular probiotics that can certainly help with some diarrhea, particularly in a setting of infectious. There's some data for L-glutamine and post-infectious irritable bowel. We're waiting for more studies to come along. There's also great supplements for functional dyspepsia, indigestion, and epigastric symptoms. And then there is great enzymes that can help people who have carbohydrate intolerance. 65% of all adults are lactose intolerant. It includes, me and probably many people in this webinar. And taking Lactaid, the lactase enzyme could really help with that. There's also ones for fructose intolerance, which is extremely common. Things that help you digest the cruciferous things, and even things that help with FODMAP sensitivity. So we're not all against these. And on the next slide, so a couple of more things. Reflux Gourmet has been something we've been into lately. It is actually an all-natural polymer that is made out of brown seaweed. And it sort of acts a little bit as like an esophageal cork. It's like a little floating raft of it that ends up sitting at the gastroesophageal junction and does not allow for acid or any sort of reflux material to be escaping from your stomach into your esophagus. And there's something called pre-leaf, outside of the usual, Tums and all of the things that are over the counter supplemental format. There is some data, some limited data for particular supplements for inflammatory bowel disease like Crohn's and ulcerative colitis. Very importantly, noting that these are to be done as an adjunct, not as a treatment for IBD, but basically something to help along with IBD and healing. So, one of them is curcumin, and there's data for a particular strain of probiotic for those patients who have had their colon removed for refractory ulcerative colitis to manage inflammation in their pouch. Too much curcumin has its own issues. Sorry, I'm like Tamara's driving and I'm trying to catch up with her. So on the other hand, there are this is a very busy page with many supplements that don't necessarily have any evidence basis at all. And these range actually from likely benign and harmless and okay, if you like it, take it, to potentially very harmful. I'm not going to go through the whole laundry list, but we could, do some highlights. So, for example, starting with number one, so activated charcoal is, used to, decrease gas and all of that. It actually has been shown to decrease some of the smell of gas, but not actually decrease the amount of gas produced, but very importantly, would potentially bind up all the other medications that you are taking. So if you're taking multiple prescription drugs, they're essentially not going into your system whatsoever. Allicin is just a garlic extract and can cause some significant gastro side effects when high dosed, and also acts as a little bit as a blood thinner. Chlorophyll is basically the green pigment of plants. So I would say if you're into that, just eat a lot of green leafy plants, and that would be a better option. Collagen is just sort of partially digested beef protein. So, eating protein will get you in the same place. Probiotics will have a whole separate section on, and, oregano oil is completely benign for the most part, unless you're allergic to it, but really not shown to have much effect. And now moving on to, the hot, new guy on the block, CBD, right? So CBD is now the it thing that's supposed to be the cure-all for absolutely everything on planet Earth. And in short, there's tons of research going into this, and there's very strong evidence that cannabis does have many therapeutic effects on the GI system. So there are receptors, in our gut for, cannabinoids, and they play a role in multiple things, including motility, inflammation, sensory functions, and have had a lot of success. Medical marijuana has been very successful in managing chronic nausea, abdominal pain, poor appetite, and diarrhea, as well as, in other forms and other conditions where it's been really helpful in chronic pain management. But conversely, marijuana also happens to be one of the most common reasons, for patients to be presenting to the ER with vomiting. So there's actually a whole new diagnosis called cyclic vomiting syndrome, that, so it's ironic that it could both help nausea and cause nausea and vomiting. And it is becoming a very big problem in the world of psychiatry, with significant effects on anxiety and drug-induced psychosis, particularly in young people. So the difference, there's a big difference between medical marijuana and what you're getting in the street. And New York State has a wonderful legal cannabis program, and New Yorkers are able to access safe medical marijuana that is precisely dosed, that is driven by a physician who is licensed and certified to prescribe it. So actually, Dr. Goldstein, who's moderating this webinar, happens to be a licensed prescriber, the only one that we have at NYGA at the moment. And there's a big difference between medical marijuana, medical cannabis, and getting your stuff over the counter, because we know that the stuff you're getting medically will be lab tested. So it's not going to be laced and contaminated. I'm sure everybody has read about the dangers of, laced marijuana that kids are getting in the street, with fentanyl and God knows what else. There's vitamin E acetate in a lot of the vapes that are non-regulated that causes pretty significant lung injury. We know that the dosing is precise to what the effect we're looking to achieve. So the ratio of THC to CBD will be actually targeted to your issues. And it's regulated, and the dispensaries are monitored. And this is not all the corner stores that are opening up literally on every block that, we have no idea what they're selling. So just like any other dietary supplement, when you're guiding over-the-counter CBD, the questions that come up are, does it even have CBD? We're not sure. How much CBD does it have? Is it the dose that's listed? Are you getting too much? Are you not getting enough? Does, one bottle to the next even have consistency? We're not sure. And will the CBD be effective for what you are trying to achieve without the THC component? Will it not be? Are there any of these, kind of undeclared concerning ingredients? And also, is there any reason that you should not be potentially taking it? So, if you're looking in that direction, the recommendation would probably be to go the medical route, and still get everything you need. So I'm going to hand the probiotic intro to Tamara, and I'll pick up after.
Okay, I forget where you pick up, so you'll just have to remind me.
I will remind you.
Okay, so probiotics and prebiotics. So sometimes people get a little confused what they are, so I just want to make sure that we all know what we're talking about. Probiotics are actual live organisms. They are the actual bacteria, and not all bacteria are considered probiotics. So to actually be a probiotic, it has to be a species and strain of organism that has been tested in humans and shown to have a health benefit. And, to whatever, spoiler alert, like a lot of the stuff that is marketed as a probiotic has never actually been tested in people and shown to have a benefit. And so I think a lot of marketers are playing fast and loose with the term probiotic. A prebiotic is not a live organism. A prebiotic is fiber. Prebiotics are fiber supplements, but they are very specific fiber supplements. They are a very specific type of fiber that selectively is preferred by some of the most beneficial bacteria in the microbiome. In other words, like there's certain types, categories of bacteria, lactobacilli and bifidobacteria, that generally have a lot of strains within them that are really beneficial. And they produce these nice anti-inflammatory compounds when you feed them well. And so the idea is, if you can kind of eat more of the fibers that those particular bacteria really love and ferment, and then as a reward to you, they produce all these really helpful metabolites. And so prebiotics are food for the probiotics, if that makes sense. Okay. So prebiotics are, feed the bifidobacteria and the lactobacilli. In order to feed them, they have to be fermentable, right? That's what feeding bacteria is. Bacteria ferment things when you feed them. And when we do that, they produce these metabolites called short chain fatty acids. One of them is called butyrate. You might have even heard of butyrate. It's very popular right now. A lot of people are trying to supplement butyrate. Spoiler alert, it doesn't help to supplement butyrate because your body's going to digest it before it makes it to where you need it to be. But we want a lot of butyrate, and you get butyrate by feeding these really beneficial species of bacteria. Sounds great, right? The problem is that when you feed bacteria in your gut, they will produce gas. Now, it's not a health problem. Gas is medically benign, and it's, your reward for feeding nice bacteria. Some of the people with the healthiest diets in the world are the gassiest people in the world. But if gas is a problem for you, prebiotics supplementally will be a big problem for you. They may be sold under different names. Inulin or chicory root fiber is something that you'll see in a lot of fiber supplements. You'll see it in a lot of foods, and a lot of like fiber-rich foods, or foods that are said like with prebiotics. You might see it listed as resistant tapioca fiber in a lot of keto products. You might see a Jerusalem artichoke fiber. Yacon syrup is another word for basically liquid inulin. You might see something called fructooligosaccharides or galactooligosaccharides, FOS, marketed. All of these are names for related types of prebiotics. But even in very low doses, these can be incredibly gassy for people. Inulin in particular, when it's been tested in healthy volunteers, they start to report uncomfortable gas symptoms in doses of about 5 to 10 grams, which is, probably like a third of a pint of Halo Top, basically. So, if you eat the whole pint, even if you don't have IBS, that might be a problem. And, people who have IBS have a much lower threshold of tolerance in general for inulin. Even like a gram, can really do it. So if you have IBS, if you're plagued by chronic gas pain, prebiotic supplementation is probably not for you. Now, having said that, prebiotics, objectively do a good thing in the body. And like, we have a lot of foods that are natural sources of prebiotics, like the gaseous foods, right? Like onions and garlic and beans and artichokes. Like, these are all like natural prebiotic sources. And we like them because they do support the abundant growth of the bifidobacteria and the lactobacilli. And so if you are concerned with your microbiome health and you want to really support the heroes in your microbiome, but you have gas problems, there is a newer prebiotic called Beta GOS. It's marketed under the name Bimuno. I think GNC sells it. And it seems to have prebiotic effects without the gas. And so for those people inclined to try manipulating their microbiome through prebiotic fiber supplementation, but worried about the gas, Bimuno might be something that you could explore. Is this still me, Yevgenia? Okay. Now let's talk about probiotics. It is a huge market. The number one thing that I think shocks people when they, come to see us is that we barely ever talk about probiotics, and we don't recommend them very often. And like, everyone just assumes that like you should be taking it like it's a multivitamin. Like, oh, you take a multivitamin, you take a probiotic. Like, everyone needs them. They're really important for gut health. It's a really, really big business because it's a really, really well-marketed business. Probiotics are not cheap. Some of the biggest brands are 20 to 30 bucks a month, but now with all these like very specialty companies, these online companies like Seed, etc., like, I mean, you could be spending $50, $100 a month easily, and sometimes even more. So these are not cheap. a lot of probiotics are like, some probiotics are still sold as single strain, like a lot of the big top selling brands in the US are single strains, but like now more and more you're seeing these multi-strain cocktails or things that are called symbiotics, which have prebiotic and probiotic in the same product. And then kind of like the hot new marketing thing with probiotics is these spore-based probiotics, which the manufacturers are claiming that they're more resistant to stomach acid. Like in other words, your stomach acid isn't going to kill them before they get to the colon. But of course, since we all know that none of these claims are regulated by the FDA, who knows if that's even true? As we alluded to earlier, mislabeling affects the probiotic category just like it affects other supplement categories. For me personally, my biggest concern for my patients as far as mislabeling with probiotics is for my patients with celiac disease, because now that we've seen that study on top selling big brands of probiotics, at least, as of, within the past decade, hopefully that's changed, but who knows, because nothing's been retested. I'm really worried that gluten is going to be in their probiotics, even when they say gluten-free. The last data we have is that 2015 study, and it showed it was about half of products. So it's a little bit of a crapshoot if you are someone with celiac disease and you are taking probiotics. And then the other thing you have to wonder about is whether this product has ever been tested, like this particular species and strain has been tested in humans and shown to have a health benefit, and what was the health benefit. The quality control is an issue in this category, as it is with other categories. There was a 2022 review of, looking at probiotics sort of across the world. The real mislabeling issues were along two dimensions. Number one, just products that had way fewer numbers of viable probiotic cells than they claim. So if they say they have like 10 billion colony forming units, and then they find that the product really only has 2 billion colony forming units. Like that's a really big difference, especially because your stomach acid they're not all going to survive the journey, right? And so, starting out with way fewer doesn't leave you with very much. And then really, really common is products that have different species and strains than the ones that are labeled. Again, coming back to the issue of, they say that they have this strain and that strain has been tested and shown to be potentially beneficial, but then the product you're taking that says it's that is really something else. So you're not even really getting that thing. So again, it's kind of the wild, wild west when it comes to marketing probiotics, no different than other categories.
Now I take over now. It's me now. So I think, the big thing is to really understand, and the most important question you should be asking when you're considering taking a probiotic is, will these actually colonize the gut? Because the whole point of taking it, right, is to presumably have these, good, better, favorable bacteria take up shop and start living in your gut and start modulating it in a positive way. And the question as to whether they actually colonize the human gut is complicated because, quite frankly, even there's plenty of really great, solid, scientific studies on probiotics that have great outcomes. And for each one of those, there are equally great, sound scientific studies that show completely opposite results. So there's, not quite a consensus. And most of these are obviously done on, there's a lot of animal model studies, and humans are quite a bit more heterogeneous in terms of age, in terms of diet, in terms of genetic background, and their microbiome configuration. So they may respond very differently to the very same interventions, and the degree of colonization will vary quite significantly between individuals. Basically, kind of this is a big, important study that came out that showed that one's microbiome has to be permissive to colonization. And that's not necessarily predictable, by looking at someone. So your microbiome has to sort of allow for other species to be colonizing it. Moreover, very importantly, stool composition is not what reflects colonization, because colonization at the level of the actual intestinal lining compared to what is shed in the stool is not necessarily the same. So it's, kind of one of the many reasons, to allude to some other, non-FDA approved testing, things like the GI map and all of these stool sequencing studies are not necessarily reflecting what the microbiome, and I think you guys could, hopefully figure it out from the graphic, but not necessarily reflecting what is happening at the level of the lumen. And it's also unclear whether any of this colonization that you may even get if you are permissive is actually persisting beyond the period of supplementation in the host person. Moving on, I think you moved it in the opposite direction, but fine, we'll skip it. So the most studied probiotic out of all of them is Florastor. It's Saccharomyces, which is actually a yeast-based probiotic, and there's been some evidence that it reduces risk for antibiotic-associated diarrhea in adults and kids, but there's been some dispute over this as well. Moving on to we'll talk about it a little bit later. Moving on to the next slide. So the actual data, the most recent data, is that not only do we not have much clarity on colonization in the healthy host, but we actually now have evidence that probiotic use actually impairs the recovery and reconstitution of the host microbiome after antibiotics use, and actually leads to a more persistent dysbiosis because it interferes with your body's natural way to recover. So ultimately decreases both the quantity and diversity of the microflora, which can lead to a lot of downstream side effects when it comes to health. So, and last but not least, kind of some of the more groundbreaking data that we're all discussing lately in the GI world is that there's data emerging that probiotics actually lead to the increase in what's called the resistome, which is basically a gene reservoir that is part of the microbiome in the human GI tract that is responsible for antibiotic resistance. So ultimately, taking probiotics may lead to patients having more resistance to antibiotics that they may ultimately need for other health ailments. So to summarize, our position on this, next slide, T, sorry. That from everything we know so far, most probiotic supplements are not likely to benefit most people, even when they have GI diseases, even if they have GI symptoms, because there's been no real measurable effect on the gut microbiome. So, it's a very, very, very complicated ecosystem that we have in there with trillions of organisms that sort of live in and on us at all times. And to have an outside species, infiltrate, make it all the way to where it needs to and infiltrate is highly unlikely. And usually they will disappear within a week of stopping said probiotic, plus will also constitute a very, very, very infinitesimal amount of the total microbial population. So, measuring the risk benefit, given everything that we know, we do not recommend it. So this is not just our position. So T, next page. This is actually the AGA. So the American Gastroenterological Association, which is kind of one of our governing bodies in GI, essentially has no real recommendations for probiotic use. There are very few, that you see in the first, box is there are 3 indications for which probiotics are indicated. 2 of the 3 have extremely low quality data for recommendations. This would be preventing C. diff infections in adults and kids who are taking antibiotics. That kind of goes to Florastor and a couple of other ones. Managing pouchitis with a very particular strain. So those people who have had inflammatory bowel disease, have had their colon removed, have a J pouch, have inflammation of said pouch, it could be helpful. Both very low quality. And both of these probably do not apply to most people on the webinar. And the only one that has reasonable, moderate quality data is the prevention of necrotizing enterocolitis in preterm and low birth weight infants. So once again, none of those are on this webinar today. There is no evidence at all at this point to recommend it for IBS, for treatment of IBD, or for treatment of C. diff, and the AGA will only recommend these as part of a clinical trial if one is participating in that, and definitely not recommended for any acute, infectious stuff. So, the kind of by indication, what we see is particular strains for particular issues are those that have some limited data, moving on to I think this is the last of my tea, and then it's you again. So, big thing, big hot topic, SIBO, probiotics, I should take good ones, I should take, versus replacing my quote bad flora with good flora. SIBO is really your normal flora. It's just flora that is now occupying a space that has become permissive to it for a reason, because there's some sort of physiological breakdown that's allowed that to happen. So there's currently no evidence whatsoever that probiotics will prevent SIBO, or that they would help treat SIBO without the use of antibiotics. So there's a couple of studies that have been done on this. Actually, to be precise, only 7 very small studies that have looked at that particular topic. 5 of the 7 had no statistical significance to their outcome, and one, the 6th had never actually retested anyone for SIBO after they completed a probiotic protocol. So no idea what that means. So this leaves only 1 study in all of these years that had all of 53 people in it. And just to, to give an idea, generally for drug studies and other, I mean, we need thousands of people to really, the minimum hundreds of people in each arm. This is a total of 53 people that did show an advantage of using probiotics to clear SIBO compared to placebo, as opposed to compared to antibiotics. But caveat, this would be patients with chronic severe liver disease, so kind of, more on the cirrhotic side, which, is not everyone that comes in with this issue. And the thought is that, the probiotics could be risky to use with SIBO altogether because something is allowing the colonization of your small bowel. So, dumping a few billion more bacteria into that very space that's being hospitable, can actually cause things to recur. And we've all seen this happen in our patients. And also, once again, kind of going back to the resistome, is that using these probiotics will then make you less likely to respond to antibiotics in the future if we were going to go that route. So we definitely recommend avoiding any bacterial probiotics in patients with SIBO or SIBO risk factors, which there are multiple. And when we do use them, we limit them to a yeast-based one, so that Florist or the Saccharomyces boulardii, especially if we have any concerns for C. diff as part of what may be going on.
Okay, and I'm gonna finish this off with just a couple talks about fiber and supplementing fiber. So when we think about fiber just in the food supply and in our bodies, we really kind of think about it along 2 different categories. All fiber is indigestible to humans, so all fiber does end up in the colon. But the different varieties kind of behave really differently in the colon. We've got the soluble fiber, which is water soluble. It dissolves in water and it kind of forms a gel. The mental image here is oatmeal, kind of gets gooey, gummy, and viscous. And that viscosity typically actually slows your roll a little bit, kind of slows things down, kind of sucks up a little bit of extra liquid. And so if you're kind of prone to like loosey-goosey kind of diarrheal stools, like frequent, like soft things in the morning, often soluble fiber, if you take it at night, will kind of form things up a little bit, slow things down a little bit, make things less urgent. Insoluble fiber is not water soluble. It does not dissolve in water. It maintains its physical properties. It maintains its bulkiness. It's often used in the body, like in our diets, as a bulker that kind of bumps up against the walls of the bowel and kind of tickle them a little bit and make them kind of react in response to that contact. And it typically speeds things up, which, often people who are constipated find that, having a salad here and there, like kind of gets things going and gets that urge going. But it does a really lousy job for the most part, holding on to water with, some particular exceptions. But generally speaking, a piece of lettuce, you put it in a cup of water and it's just a wet piece of lettuce, right? It doesn't really absorb very well. So the bulk is really where it exerts its impact in the GI tract. So understanding that there's kind of like these different properties of fiber enables us to use fiber supplements to really manage GI symptoms. And fiber supplements are probably the most common supplement that I use in my practice, maybe except for magnesium. And so if someone, for example, is diarrhea prone or urgency prone or has diarrhea predominant IBS, so like their morning is a really tough time of day where they're back and forth to the bathroom, they have to wake up an hour too early just to finish toileting before they get out of the house. Taking a soluble fiber supplement that kind of increases that viscosity of the stool and kind of glues together all those like little incomplete soft pieces that, just are kind of running through you, can be super helpful. And so products that fall under this category are methylcellulose, marketed as Citracel, wheat dextrin, marketed as Benefiber, if you are not celiac, acacia fiber, which is marketed generic and also has a product called Heather's Tummy Fiber, guar gum or partially hydrolyzed guar gum PHGG. A lot of different brands sell PHGG. All of those can have that effect. On the opposite side, when you're really looking for like something that just bulks and like kind of really like creates a bulkier stool. There's a very specific type of insoluble fiber that bulks but also absorbs, and that's it's not a natural fiber, it's lab made, because I guess it doesn't really exist in nature. Calcium polycarbophil, it's marketed as Fibercon, and it does a really great job for constipation. In terms of like holding onto moisture and giving like a nice bulky stool that's not like tiny little pebbles that are hard to push out, but also like allowing the stool to be bulky enough that the body doesn't have to strain to really push it. Ironically, we can also use these bulking fibers for like very severe diarrhea. So like in patients, for example, if you have your colon removed, a procedure called a colectomy, you're going to typically be very prone to like frequent, loose, sometimes even liquidy bowel movements because you just don't have all that extra surface area of the colon to reabsorb extra liquid. And something like a very absorbent bulking fiber, like a Fibercon, can also be super helpful in sucking up a lot of that liquid and creating more formed, less frequent, less urgent stools. And so I will kind of use Fibercon for that as well. And then we have psyllium, which is marketed as Metamucil, Consul, or just generic psyllium. And psyllium can actually help with both. Psyllium's a really kind of good all-purpose fiber. It's a switch hitter. So if you're not really sure what kind of fiber to use, like psyllium's not a bad place to start. Just be aware that certain brands, including Metamucil, can have a ton of added sugar, like a lot, like 20 something grams. And so if you are going to use psyllium and sugar intake is a concern for you, you might want to choose your brands wisely. But psyllium can help with both diarrhea as well as constipation, and can be really helpful, and it's really widely available. So to kind of close it all out, a bunch of key takeaways from today. There are a modest number of supplements that are absolutely safe and effective in general, but specifically in our world for the management of GI symptoms. We are not against them. We like them. We recommend them all the time. If you're our patients, you know that we recommend them all the time. But there's even more supplements that have not been demonstrated to be effective. And frankly, a lot of them have not even been demonstrated to be safe for the management of GI symptoms, but they're really widely used out there in the world. And the risk is non-trivial for certain dietary supplements, especially in those certain categories, weightlifting, weight loss, bodybuilding, and sexual function. When you're using multiple products, like more than, 3 or 4 products, especially products that have redundant ingredients. When you have underlying medical conditions or you take a lot of medications, we're concerned about those interactions. And, don't ever lose sight of the fact that the dietary supplement industry is basically unregulated. It is up to you to figure out if a product is safe to take. Natural doesn't mean safe. Just because it's on the market in a nice, reputable store doesn't mean it's safe. Just because the label says it's safe or gluten-free or XYZ doesn't mean that that's true. This is a very buyer beware area. And so, our philosophy as providers is less is more, to be judicious with your dietary supplement use, to use things, thoughtfully and judiciously, and not really think about supplements as insurance policy, can't hurt, might as well take extra. That's not how we really think about it, because of those risks. So I'm going to close it out here and I guess turn it over to Dr. Goldstein.
Yeah, and then I also, just kind of, the last 2 cents is, I think a lot of my patients have heard me say, that, just echoing Tamara is, just because it's natural, organic, gluten-free, or, dairy-free, and kind of all the labels like to put there does not mean it's good for you and does not mean you need it. Less is often more. And, very importantly, the converse is, I don't argue with anything that works as long as it's safe. So there's plenty of people that come to me and they've been taking X, Y, or Z that has no real credible data. And they feel like it's really helping their symptoms. They feel fantastic on it. They're healthy, they have their liver and their kidneys are monitored, there's sort of no signs of toxicity of any kind. By all means, whether it has data or not, whether I believe it or not, if it's working and it's safe and it's causing you no harm, that's great, but we're going to steer people towards the evidence-based versions of things.
Okay, so we got a couple of questions about the pros and cons, or even the categorization of quote unquote sort of probiotic foods or prebiotic foods, what's what, benefits, risks, specifically looking at things like yogurt, kefir, kombucha, sauerkraut. are they okay? Are they good for you? Are they bad for you? What do you even classify them as? Go.
So I'll start with this one. So
Yeah,
yogurt
please.
actually, so all of those are food. So first of all, food is regulated by the FDA, and yogurt very specifically has to have Streptococcus thermophilus to be called a yogurt. And so yogurt is regulated by the FDA. It absolutely has to have at least one probiotic bacteria in it to be even called yogurt. And the FDA does actually police the yogurt definition. And so yogurt very likely has what it says it has in it. And yogurts typically don't claim how many colony forming units that they contain. So it's just that they'll have the species and strains. We're not concerned so much about safety of yogurt because unlike a probiotic, which is encapsulated and protected from your stomach acid, the bacteria in yogurt and cultured foods is going to be exposed to your stomach acid. And so you're not getting these like potent doses delivered, intact to the gut. A lot of them die on the way, and like a couple of critters do kind of make the journey to the colon. We do see that in studies that yogurt, we do see some of the cultures in yogurt show up in people's poo. So we know that some of it does make the journey, but we're not concerned that these are such potent high doses that are encapsulated that they're going to risk SIBO and things like that. So we love yogurt, we love cultured foods. You can't make a specific health claim really that like if you eat drink kombucha twice a day, like it will reduce abdominal pain by 40%. Like we can't make claims like that. But in general, there's a very long history of large studies showing that people who eat cultured foods habitually, not just randomly one off, you have to eat these things habitually because the bacteria get pooped out. They die, like they don't colonize. So habitual intake of probiotic rich foods seems to be just generally beneficial and safe, and we love it.
Terrific. Thank you. We got a couple of questions about bacterial overgrowth. I believe we have at least one, if not multiple talks on that on our NIGA website. So I'm just gonna direct our listeners to that, don't we? We've
Yeah,
done
I think
some
we
talks.
have it in the IBS mimickers. There's
Okay.
definitely a section
Maybe
on
there's
SIBO,
somewhere.
but
So it's sort of
sort of-
outside the realm of our talk. I just didn't want
Yeah.
anybody to think I'm ignoring the questions. Got a lot of questions about the safety of some specific supplements that weren't really touched on in the list. Polysorbate 80 and polyethylene glycol being questioned. Certainly those kind of came to light in the era of the COVID vaccines as a potential allergen. If you're allergic to polysorbate 80, don't take it or take things in it. But generally speaking, that when we talk about polyethylene glycol, we are not talking about polyethylene glycol 3350, which is Miralax, or what we often use for colonoscopy prep. And so I want to just stress polyethylene glycol is a single molecule. Polyethylene glycol 3350 is a gigantic polymer, which we use for constipation, as Miralax generally considered safe to use daily and indefinitely because it's way too big to be absorbed into the bloodstream. It just kind of comes in and goes out the same way that other indigestible things. Again, that there's a lot of questions about some other specifics. Got a few questions about curcumin, asking if it's effective. And of course, I would counter with, is it effective at what? But I assume that the questions are referring largely to anti-inflammatory properties. So, comments?
I mean, it's certainly known to have some, and it's certainly known to be beneficial for a lot of different things. I think it goes back to question of formulation and whether, how much of it are you getting? Because when there's a little too much of it, it could also have some significant, side effects actually of the GI world, among others. Correct me if I'm wrong, Tamara, but it's
Yeah, I think the best data that I've seen on curcumin is with respect, like it's been tested, like the most data I've seen is with respect to ulcerative colitis. And there is some decent data to suggest that, it helps medication work better. So like on its own, it doesn't seem to like induce remission in IBD, like without medication. But when people who are already on medication add curcumin to their mix, it seems to induce a remission at higher rates than people who are just doing the medication alone. And that's what we mean by an adjunctive therapy. And actually there's like a new curcumin blend with some other product in it that I think is coming out of Israel that like that just hit the market that had some good data on it. And so I think we're going to be seeing more curcumin in that regard as well as an adjunctive therapy. There's not a whole ton of data on curcumin for other GI symptoms and even for things like, rheumatoid arthritis and joint pain, like there's not a whole lot of data on that. But again, like, it's generally if the doses aren't like terribly potent, like it's not one that we're typically really concerned about from a health or safety perspective. I mean, it's, the active ingredient in like a culinary route that is, part of a staple diet of like the entire Indian subcontinent. We're not overly concerned about it as long as, it's well tolerated.
Okay, so we'll end with one last question, and I'll apologize in advance if I don't get to everybody's specific questions here, but a lot of questions on the enzyme therapies. We talked a lot about the ones for which there are good evidence of efficacy and good evidence that they actually survive your digestive system. Okay, like the lactate, the fructade, the FODzyme. But there are a lot of questions about other sorts of more broad digestive enzyme things.
So
But
I
you
could
comment
start this one
because,
a little
my
bit.
feeling about it is that most of them I don't recommend. But go ahead and comment, please.
Yeah, I mean, most of the time, so a lot of those blends tend to, advertise lipase and amylase and sort of all sorts of pancreatic enzymes that if you have a normal functional pancreas, you should not need to supplement. Additionally, real pancreatic enzymes are prescription medications, which are, complicated and expensive because they have to be heat stable, they have to be pH stable, they have to be able to survive, the very harsh environment of your stomach and get to your small bowel to actually be active. And we have no idea whether these over-the-counter ones are doing that. A lot of the times they're also combinations of things like lactate, and fructade and kind of all of these things, but kind of rolled into one, probably with a little gas X and a few other things. So they might make some people feel better, just because they're involving some of these other enzymes. But as far as working in some magical way to help you digest better, there's sort of no evidence for that at all. And they usually tend to be pretty costly, whereas you could, probably buy lactate or Beano for a lot less and, kind of use that more selectively.
Yeah, I would just add to that, enzymes are specific for specific chemical reactions. So if you're super gassy because you malabsorb, the fiber in beans called galacto-oligosaccharides, taking a digestive enzyme that's mostly just like pancreatic enzymes is going to do nothing for you. And so you don't want to just take like digestive enzymes generic. You have to really try to work, I mean, with a dietitian if possible, or on your own to figure out like what really in my diet is causing gas, and is there an enzyme targeted to that particular component? And the problem when you do a big cocktail that has like, 10 to 15 different enzymes is the doses can be really, really low because they have to fit it all in one pill. So if really your problem is beans and 80% of the real estate in that pill is being taken up with stuff that doesn't help with beans, the dose of the bean digesting enzyme is really low, and you might do better taking a higher dose of a single enzyme product. And so really understanding what you maldigest, if you maldigest something and what you maldigest, and then finding the most potent, efficacious enzyme for that problem is the best way to think about using digestive enzymes.
And I just want to reinforce what Dr. Pashinsky said about sort of the purpose. Remember that enzymes are proteins. If you're missing a protein, adding it to the reaction that is your GI tract may be helpful. But if you already have protein digested enzymes, you're going to digest the enzymes you take. They're not going to digest for you. So they're really just going to kind of be a very expensive and unnecessary protein supplement. Okay. thank you both. This was wonderful. We had questions. I'll just remind you that yes, this will ultimately be posted up on our website. And so if you missed any part of it, it will be up there eventually, not necessarily right away, but it will get there. Thank you, everybody, for coming tonight.
Thank you, everybody. Have a great evening.